very beautiful Thursday morning, being the 26th day in the month of September 2024. And welcome to another beautiful day of the issues on IKD 106.1 FM. Today, as we all know, every Thursday is a special edition of the issues where we talk about health matters. Yes, we discuss every critical areas concerning health, how best you can live right, and of course, how best to prolong your life cycles by living right through health. And of course, from the General Hospital Ikeja, Ikorodu, pardon me, we have a wonderful, yes, wonderful pharmacist in our midst today. Today is a special day because we are actually celebrating World Pharmacist Day, yes. So every topic today is in commemoration of World Pharmacist Day, which was yesterday, the 25th day in the month of September 2024. And today on our Health Matters, we're going to be talking about how best one can take care of themselves through self medication, enlighten us on self medication, the dangers of self medication, and not just that, also, there's also an elaboration and enlightenment when it comes to pharmacovigilance. Everything you need to know about it is what we're going to be discussing today. But we'll go on a quick breather, and when we return, we'll dive straight to the meat of the matter today, introduce our guest who's already in the studio, and then we'll kickstart the issues for today. And a big apology for starting the issues late today. It's due to one or two occurrences, but definitely a way to serve you better. Be right back. Welcome back. It's still the issues on IKD 106.1 FM, and today is Health Matters, a special edition where we discuss every critical areas concerning health, yes, on the issues today. And today we're discussing self medications and its dangers. And not just that, we're also going to be discussing about pharmacovigilance, yes. And of course, I'm your host for today, Gift Ogbona. And with me in the studio, I have Dr. Ogudu Ugochinyere in the house. And also we have Akazi Dorothy. She's also here with us together. We shall be dissecting the dangers of self-medication, and not just that, and also pharmacovigilance. And you can do well to be part of this conversation if you have any questions for our pharmacists who are in our midst. But first, let's introduce them. Good morning and good to have you today on the show.
Good morning, everyone.
Mm.
This Farm Doctor Gochinyere Gudu, and with me is my sister, pharmacist Dorothy Akeze. Yesterday, we celebrated the World Pharmacist Day, pharmacists improving global health,
Mm-hmm.
and you can agree with me there are various ways we do that. And most especially as custodians of drugs, drug experts,
Mm-hmm.
we've seen the good side as well as the dangers. And today we are talking about the dangers of self-medication. Many
Mm.
of you will be asking me why? Are they really dangerous? Yes.
Okay. Before I go to you, Farm Ugochinyere, let me talk to Dorothy, beautiful Farm Dorothy in the house. Good morning and good to have you on the show today.
Good morning. I'm happy to be here today.
Yes, and I can see under it, you will be discussing about pharmacovigilance, right? Can you
Yes.
give us a quick intro when it comes to pharmacovigilance? Because that word kind of would be new to some people.
Okay. Pharmacovigilance refers to the science of monitoring, reporting, assessing, and preventing adverse drug reactions. Adverse drug reactions are unwanted effects we get when we take medications. Medications don't just come with positive effects, they are also unwanted effects. Let me take, for example, when we take some anti-malaria drugs, we notice that we become even weaker than before we started taking it. And then you see some patients, they say, oh, I don't want this particular anti-malaria drug because whenever I take it, I can't do anything. I'm useless for the whole day. That is an example of an adverse drug reaction.
Okay. Okay. Still on this pharmacovigilance, you just talk about the dangers of it. I need an elaboration of it when it comes to, because we are actually celebrating the World Pharmacist Day, and as a pharmacist, I know that there's a lot of things when it comes to one being vigilant with drugs to take and the dangers of it and all that. Can you also run us through that?
Okay, when it before a drug is released into the market for use by patients, there are steps taken. First of all, there's animal testing where animal is tested on animals to check if they are safe,
Okay.
and then they are tested on just a handful of people, just a few people to see how safe it is before it's now released into the market. And even after it's been released into the market, yeah, there is still post-marketing surveillance where they are still getting reports of adverse drug reactions. So let me give an example. In 1950s, 1960s, there was this drug, thalidomide, that was used to take care of nausea in pregnant women. So over time, they noticed that that drug was affecting the babies that were being born by those pregnant women because they were either they are dead or one eye is missing, one leg is missing, one hand is missing. So because people kept reporting, it was withdrawn from the market. Then other advantages we can have is there are some drugs, not all side effects are bad. Let me take, for example, sildenafil that is currently used for treating erectile dysfunction in men. When it was first brought into the market, it was to treat heart problems, hypertension, angina. So men kept coming back, to say, oh, they were experiencing stronger erections. And then that aspect of it was now explored. And then now it's now used as well for treating erectile dysfunction. Also, when people come to report side effects or adverse drug reactions, you can notice even in old drugs, it's not just new drugs that are into the market, even old drugs that we already know, there may be problems with the batch. So you notice that sometimes they will put out notice that, okay, if you bought so time, return it. Do you get? So that one, you can notice problems with batches or affected batches of drugs. Also, when you report adverse side drug reactions, it's noted in the patient's medical history that this patient reacts to this particular drug. So going forward, the physician knows not to give the patient that same drug again. And then another thing is, patients should not just stop the drugs and just say, oh, I don't like this drug. You need to come back and report so that it's documented, and then going forward, it's not given again. Then when people report adverse drug reactions, it's not just for their own good, it also affects future people. Because now we in 2024, we don't use thalidomide anymore because people in 1950s reported it and it was withdrawn from the market. So that is another good reason why people should report. So we've noticed that there is underreporting. The reason why there is underreporting now is because some people do not know, is this thing I'm feeling a side effect or is it caused by something else? So the right thing to do is to report. Whether you are sure or you are not sure, still come and report. Report to the pharmacist, report to the doctor, report to the nurses. And then another thing, okay, let me talk about the form. There is a form for reporting. It's a yellow form, and then the things inside the form are the details of the patient, the name, the age, the sex, and then the drug that is being reported about, the dosage, the name of the drug, the batch, the company name, the dosage, and then the dosage form. Was it an injection, a cream, a tablet? How were you using it? When did the reaction start? When did it stop? How long did you use the drug for? And then the reaction will be described. Then it's also noted if it's how severe that reaction was. Then it's also noted if the patient was on admission. If that adverse reaction led to a hospital admission, then it's the length of time the patient was in the hospital. That one will be noted as well. Then another thing that is noted is the list of all the drugs the patient was taking. Because sometimes, like I said, anti-malaria drug now, sometimes you use paracetamol with it. So you also note the list of drugs that the patient was taking at that time. Then the dosage form and all those ones too are also recorded and submitted. So this data, when all these data are collated, they can help with treatment guidelines. Physicians can now say, oh, when this drug is taken at this dosage, this is the side effects that is recorded. So do we reduce it? Do we reduce it? Do we increase it? Like that is like what I mean by treatment guideline. So basically that's what pharmacovigilance is.
Then how can a patient actually know that he or she is facing this particular reaction? Because sometimes you take as paracetamol as just like paracetamol, and then for example, I'm using paracetamol as an example,
Okay.
and maybe perhaps they start having reactions, maybe itch in the body or something. Some people will just tell you that it's due to the drugs you're taking. Is normal, is common. And maybe if someone takes anti-malaria drugs expecting, or paracetamol, let me use it as an example also, and you were expecting your headache to go and it increases and you're not fine. Somebody said, okay, maybe because you're taking an Emzo, for example, the blue one, you're supposed to take the red one, all that. How would a layman actually know that, okay, this drugs is reacting, is not the work it's supposed to do is doing? How would they know? Because sometimes you just take this drug, somebody tell you it's because you actually take drugs, it's supposed to be that way. That means it's working. Do you understand? Not reacting. They just feel that is how it's supposed to work. So then, educate a layman. How would you know that this drug is reacting?
Okay, there are two things you have brought up now. You have brought up side effects and you have brought up efficacy.
Okay.
So when you take a drug and you are not getting the reaction you expect, for example, you said you use paracetamol and the pain is not going, the pain is still there, you are still supposed to come and report it.
Okay.
This pharmacovigilance, we can escalate to the company and let them know that this your drug or this your particular batch is not giving the therapeutic effects we want.
Okay.
Then for the adverse drug reaction, we know our bodies, we know when something is wrong, when something is off. So once you notice something is off, you should report it. For example, you said something about itching.
Yes.
There is something called Steven Johnson syndrome. It can come in a mild form, it can come in a very severe form, where the entire skin is burnt and quotes, leading to blisters. Now, some drugs, let's say, for example, now Fancida causes it. So, before a patient is placed on a drug like Fancida, a drug like Septrin, they usually ask, have you experienced any itching before when on this drug? Have you experienced swelling? Have you experienced boil when on the drug? If the patient says yes, even if the patient says it was just a little, it will be noted down. Because if the patient is introduced to that drug again, it may now be a severe form of that Steven Johnson syndrome. So once you notice anything, escalate, let us know. Yes.
Okay, all right. Let me come to Farm Ugochinyere, talking about self-medication and its dangers. Can you give us what does it entail? What's the dangers? Since this is like a two different entirely, talking about self-medication first, self-awareness, and then again, this is the danger of self-medication.
Alright. Everyone takes paracetamol. Everyone takes vitamin C without prescription. Now, what is self-medication? Self-medication has been recognized and defined by WHO as the treatment, self-treatment of self-recognized or self-diagnosed ailments or conditions without prior consultation by a qualified health professional. Or it could be an intermittent or continued use of medicines previously prescribed by a professional, a physician, for a condition. For instance, maybe you had a boil, you come to the hospital, you were prescribed some antibiotics. You now go home, it goes, and then maybe later you develop something like that again. You decided to go and buy the same antibiotics you were given that time. That's self-medication. Now, self-medication has been recognized as a way of life. It's been endorsed by so many developed countries because self-medication, when properly used, can benefit both the individual, the community, the health sector, reducing the amount of time spent waiting at the hospital. Also, it also reduces the amount of money spent in consultation fees. It can also reduce the workload on healthcare workers when you can take care of yourself responsibly. However, there are dangers inherent in doing that. We were on lockdown. You can't go to hospitals. Everybody is afraid. So, but then you bought your paracetamol somewhere, somehow, and took. Now, these days, the question of dangers inherent in self-medicating arises and is threatening the whole world. Now, what are these dangers? They include misdiagnosis. You might be treating something that is not there.
Mm.
They also include the excessive use of medicines for that condition or prolonged duration of use. You could be taking two or many medicines that leads to reaction, taking us back to pharmacovigilance.
Yes.
So these are challenges and problems, and it tends to increase the cost of healthcare this time. Because with the misdiagnosis, you could either get a higher side effects, or you even create another problem. For instance, you've been taking paracetamol for a common headache and it refused to go. Now you begin to think, this thought of hopelessness. You could even get depressed as a result of that. So these are dangers and many more that we feel on daily basis.
Okay. Let me understand this entirely. Sometimes it's funny, but let me ask you this question. Are you saying if someone is having headache now or something, you're not supposed to just, we all know it's paracetamol, right? But are we supposed to also get a recommendation for just headache? Just to be on the safer side?
Not really.
Okay.
But sometimes, or most times, headache is not just an issue. Headache is a sign of something serious, an underlying condition. And that's why I think I love this advert by Panadol Extra. Panadol paracetamol says, you take Panadol after 3 days and your headache does not go. You see a doctor.
Okay.
But some people tend to take for as long, in fact, they form a habit of using it every day. But this is not good. And before you know it, they begin to add other things, for instance, alcohol. And these two combinations, alcohol and paracetamol, let me shock you, they can cause what we call hepatotoxicity. They all get to the liver and begin to attack the liver cells. Yes.
Okay.
So, inappropriate self-medication may lead to irrational use of drugs, and that will take us to drug abuse and substance abuse. So we don't want to talk about one. It can also lead to polypharmacy. Now you have tried ibuprofen, it's not working. You have tried paracetamol, it's not working. You added paracetamol extra, it's not working. You now look for diclofenac. They're all pain medicines. So we get to polypharmacy, and each of them have their route of work in the system, and they all interact with the vital organs of the body, leading to weaknesses and leading to more diseases.
Okay, let me put you on the spot now. There's some people that actually likes to take herbs and all that, and some even mix it. So what would you also say about that? Are those like a danger or something? Because we know they're in our midst and we find them in our midst every time. Some people will tell you that the herbs is even more effective. We know how to do it and all that. And then we still go about to even mix it. So
we develop many of the drugs we use today from herbs, but there are measurements. The problem with the herb vendors, there are no measurements. And sometimes you find out that they boost these herbs with orthodox medicines. Yes, they boost them with orthodox medicines. So you cannot just say, I'm taking a 30 milligram or I'm taking 100 milligram of this. It's not measured. It's not measured. So that's the problem. So mixing of herbs with orthodox medicine should be discouraged. And also, you notice that when you keep taking some herbs, for instance, let me come to the what is it called now? Lime. Or lemon. Yes.
Okay.
You notice that you keep taking lemons. Sometimes you start losing weight because it has these diuretic properties in it. You keep urinating, losing. And if you're not replenishing the water that you lost from your body, it's a problem. You get dehydrated. So herbs use is good in its way if you use it correctly. But remember, there is no measurement. That's a problem.
Okay, let me come back to Dr. Dorothy. Yes, from Dorothy. Still talking about pharmacovigilance, and we can relate it to what Farm Oguchinyere is saying when it comes to self medication and also the dangers of it. And we're talking about herbs right now, and she just did mention that there needs to be measurement and the likes. But run us through how best one can be vigilant when it also comes to antidotes and herbs. You know, one has to be vigilant, of course. And still talking about pharmacovigilance, how best can you even use this product without even? Would you also advise one to just do away with it, or better still, maybe if you're having any reactions or any occurrence of such, talking about reaction, you should just report, despite the fact that it was herbs.
Okay, I'll advise patients do away with mixing herbs with orthodox medicines, and
Okay.
even when they come down with adverse effects, they can still report them.
Okay.
When I took this particular herb, these leaves, when I ground it together, put alcohol or put water, this was how I felt. They can still report it to be recorded in the adverse drug
Okay,
reaction
now
form.
let's come down to that of children because we see most times mothers will tell you that a child is having a teeth problem. She already know the drugs to administer to that child. A child is having headache. A child is having maybe inches and all that. Is this also safe when it comes to children? Like mothers administering drugs to children without even recommendation from doctors.
When it comes to children, the drugs that should be administered are just like painkillers, but that is in the frame of time when they can't come to the hospital. Let's say in the night, the child is running a temperature
Okay.
and they cannot come. Maybe their place is far from the hospital. They can just give paracetamol at the recommended dosage. In the morning, you bring the child to the hospital
Okay.
because many ailments come with similar symptoms. So you cannot start treating on your own because you do not know if what you're actually treating is what you are treating. So just for the meantime, before morning, when you can bring that child, you can just use painkiller or maybe promethazine for vomiting.
Okay.
In the morning, you bring the child immediately.
Okay, all right. Famugo Chinyere, kindly run us through when it comes to mother taking care of child and the dangers with drugs when mothers are taking care of children.
All right. During the antenatal visits,
Okay.
they teach the mothers. If you come to General Hospital now, we have a time to talk to the mothers that come for antenatals. Now, like she rightly said, when a child is running temperature,
Okay.
it could be as a result of something. In fact, it's mostly as a result of an underlying condition. Fever is not just a sickness on its own, it's not standing alone.
Okay.
Something is causing the temperature of the body to rise. And all you need to do is for a child, get to the hospital immediately.
Okay.
Don't manage that child at home. Because with high temperature, we've noticed it leads to convulsion.
Okay.
And convulsion, there could be aspiration of vomitus that could lead to choking and even death of that baby. So I don't advise mothers to keep their children at home and treat them.
Okay.
That is far too dangerous. Because a child cannot tell you, Mommy, it is this kind of headache. Like an adult, you can say, it's one-sided headache, or I think it's my ear that is aching. A child cannot say that. But when you come to the hospital, the physicians who are trained, who are specialized in that area, will be able to use their diagnostic techniques to find out, and then appropriate medications will be given. Or procedure, it might not even be medication, it might just be a procedure that they have also learned that they will use to help that child. Mothers, please, it's dangerous to keep a child at home nursing. Don't be afraid. Lagos State has made things a bit easier compared to other places.
Okay.
We have over 37 primary healthcare centers that are close to us. Then we have about 26 general hospitals. In case the primary healthcare centers could not help, we quickly run to general hospitals.
Okay.
And we have about 4 or 5 tertiary institutions. We have university teaching hospitals. We also have federal medical centers. Here in Lagos alone, please, let us stop taking care of children at home by ourselves.
Okay. All right. To be part of these conversations, you can call us on 090408211061 or 0904081161. We have Ugochinyere in the house and also Dorothy in the house, and they're here to take your questions. If you have any question relating to self medications, if you have any question relating to pharmacovigilance, you can do well to call us on 090408211061 or 0904081161. In any case you're confused and you need one to enlighten you better or educate you on how best to use your drugs, 09040821061 or 09040811061. Back to pharma pharmacist Ugochinyere, still talking about children and all that. I've heard the cases where one said it is not good to use anything apart from serum when it comes to drugs on children. Is that true?
It's because of ease of
Okay.
swallowing.
Mm-hmm.
Sometimes it's not just syrup, we do suspensions
Mm.
so that they easily swallow it.
Okay.
You can give a child a tablet, the child may not be able to swallow. That's
Mm.
why they give paracetamol or syrups.
Okay.
Sometimes drugs can come in tablets. They have not. We don't have the formulation
Mm-hmm.
in syrups.
Okay.
So that's where compounding in pharmacy come into play.
Mm.
They'll compound and
Okay.
mix it, and and get you a suspension or a syrup for that child to
Okay.
use. Yes.
Okay, so a child can actually use a tablet kind of drugs, not
Yeah.
just necessarily.
Yeah,
syrup
but
kind.
it has to be micronized
Okay.
and turned into syrup
Mm.
or
Okay.
suspension.
Okay.
Especially if the child cannot swallow. And
Mhm.
of course, most children cannot swallow.
Okay.
So we micronize it and convert them to syrup or suspension.
Okay. How about when it comes to oral drip? Are there any dangers to it? Because I know this one is very, very common in our community. You see, women administer oral drip to children, and they tell you just for when the child is having running temperature, and they tell you that this will come the oral drip. Maybe the child is throwing up, is vomiting, and they'll say to stop vomiting, you need to give the child oral drip and the likes.
All right. It's not a yes or no question.
Okay.
The thing is, oral drips
Mhm.
are made to rehydrate a child.
Mm.
When they are running temperature, they are losing water
Mm-hmm.
via the nostril, through the skin,
Mm-hmm.
through the mouth, even through the vomit. The more they vomit, they lose water, they are losing strength.
Mm.
What is the content of oral drip? You have sugar for energy. You have what is it called? Ions.
Iron is okay.
Yes. You have elemental multivitamins
Okay.
in it
Okay.
to sustain that
Mm.
child. So that's what is there.
Mm.
First, the most important one is the water that rehydrate that child,
Mhm.
and then the element, yeah, the
Multivitamins.
multivitamins
Okay.
that help the child.
Mm.
So, because the child is running temperature, you begin to give that child ORS. Like we
Mm.
said, it is dangerous,
Mm.
far too dangerous to take care of a baby at home.
Mm.
Once you have tried your best and the child still vomits
Mhm.
or still stools,
Mhm.
why are you still keeping that child at home? Quickly rush to the nearby healthcare center
Okay.
and get help.
All right. Our time is actually kicking, but before we leave the studio, let me go back to pharmacology. What's your advice when it comes to pharmacovigilance? We all know that yesterday was the celebration of World Pharmacist Day. So talk to your people. What advice would you give as your parting words?
And listeners will be to report any adverse effects they notice when taking medications, no matter how small they think it is. Because, like I said, I gave an example of sulfur drugs and Steven Johnson syndrome. So, no matter how small they think that side effects will be.
Mhm.
Also, for mothers should be vigilant
Okay.
when taking care of their children.
Mhm.
When they give their children certain drugs, they should note how the child felt,
Okay.
so that next time they can even tell the physician, oh, when my child took this was how my child felt.
Mhm.
And then even when the child goes to, let's say, boarding school,
Mhm.
they will still tell the nurse or the doctor in the school that
Mhm.
my child doesn't take this drug
Mm.
for so reason. So Adults, children, parents, everybody should be vigilant.
Okay, all right. Thank you very much from Dorothy. And over to you from Ugochinyere. What advice would you give, knowing fully well that the world we live today, there's a lot of cases when it comes to drug abuse. So, how best can one avoid the dangers of self-medication? Your parting words, please, as an advice.
All right. The first step towards getting a solution is to first recognize the problem.
Okay.
You're medicating a particular ailment for a long time.
Mm-hmm.
You are not able to stop.
Mm.
Once you realize that it's a problem, then you seek help.
Okay.
You could directly seek this help by informing your family members, or you come to the hospital
Okay.
and talk to us. At the reception, you see people, they'll be wearing ask me.
Mm-hmm.
You ask them, I have issues, who do I talk to? They'll tell you who to talk to, either to the nurse on ground, or to the doctor, or to the pharmacist. But surely you will get answers. And when it has to do with medicines, look for the pharmacist. They are ever ready and we are there to help you.
Okay.
Even considering that these medicines you buy over the counter, you source them from pharmacies. We are in a better position to inform you appropriately so that you achieve the desired outcome
Okay.
and not cause yourself harm by taking the medicines. I keep saying it. Watchword is every medicine in the hands of uninformed has the potential to cause harm.
Okay.
But talk to your pharmacist.
All right.
They're
So
ready for you.
before I still let you leave the studio, I need to ask this one because when it comes to drug abuse, most people do say that the reason is because once they start taking a particular drugs, maybe it eases the pain. They feel that this drug was administered by a doctor, and that particular drugs was given to them to ease any kind of pain and all that. And then they take the drugs. They notice that it's very very effective. When that pain arises again, they go back to take the drugs and they keep taking the drugs as then it becomes an addiction because they feel once I take this thing, it calms my nerve, it eases my pain. Please, what would you say about this? Because the rate of drug abuse is alarming, honestly.
That's true. All over the world, we have that challenge.
Mm.
The doctor that give you prescribe you a drug that ease pain at a particular time did not say it should continue forever.
Mm.
Sometimes a doctor gives people a prescription that lasts them 1 month. He may say, you're going to be on this medicine for 3 months. Now, after taking the first 1 month dose, they don't go back to doctor. They come to a pharmacy with the old prescription. The doctor says I should take it for 3 months. Why don't you see the doctor? Let us see if having taken it for 1 month, the desired effect has come. Now, when it has to do with drug abuse, I want you to know this. There's what we call a brain reward center.
Okay.
When you take certain things, for instance, when you have sex, your brain is rewarded, you are happy. When you eat food, that part of the brain is rewarded and it's happy. The same thing with these substances or drugs of abuse. It actually gets access to the brain reward center.
Okay.
And once it gets there, what it says is, I'm so happy. And then you take again. You keep taking, then you get to a point where your body adapts to it. We get to adaptation. Now, after adaptation, you keep taking. Remember, there is a breakdown occurring that involves your kidney and your liver. So they are struggling, but as you keep taking, increasing the dose, increasing the frequency, it gets to dependence.
Okay.
And at that dependence point, your body feels, without it, I cannot function, which is false.
Okay.
If it's without this, I cannot function. So you keep taking. Now this time, you are addicted. You don't know how to come out of it. Now, warning, don't just stop. Seek professional help.
Okay.
They will help you to stop.
All right. It's really, really a big pleasure having both of you here in the studio today, Fam Okuchinyere and friend Dorothy. It's really a nice and our pleasure having you here today. It has really been educating and very, very informative, yes, and very insightful discussion having to hear all about self-medication and the dangers and also pharmacovigilance. It's really, really a pleasure having both of you today. Well, we have to sign out today on the issues because our time is fast spent and the news is coming up shortly. But what do you have to say before we leave the studio because we're about to sign out?
So we are saying today, stop unnecessary self-medication. Seek professional help.
Yeah.
You have your primary health centers close to you, and you have general hospitals not far from you. And in case you take anything, medicines, even if it is paracetamol, and you react badly, report. Come to us in the hospitals. We fill the yellow form for you, and then we report it and investigate further to know if the issue has to do with the batch that you've taken or the interactions you had
You
with
have.
other things you took.
Okay. All right. Thank you so much from Buchinere and of course from Dorothy. You've heard from them both. Be careful how you use drugs. Do not go using any drugs. You need recommendation from the right sources before using any drugs. And this is how far we have to go on the issues today. Join us tomorrow same time by 11 p.m. sharp for more insightful information. Until then, I'm Gift Ubona. Have a beautiful day.